When we play, by the way, to watch TV. TV, television. Everybody here tonight, you're no threat to us. You're no threat. The people that need to be is out in the streets. That's where we need to go, out in the street and educate our kids to go know what's going on. That's the reason they call it a television. They tell our kids.
Black neighborhood in the town of Mobile and Pritchard. Stand up for a second and see what you see. You don't see nothing. You don't see nobody. All of our people are being incarcerated. All of our people.
We do have some awards we'd like to give out before we bring our panel up. We have to come over and see this award. Can we get Mr. Fisher, a legend in the Trinity Guard community? A big hand. Thank you so much.
Penn Collins. Minnie Miller. Miss Alice Wells. Miss Sweet. Simone Wallace. Miss Shirley Johnson. Miss Joyce Johnson. Mr. Robert Coleman. Guys, listen. This person that I'm getting ready to call now is a person that has always had a big heart to serve, a big heart to help people. I mean, regardless of what that person is doing, they will stop and listen. And when they listen, they always come up with a solution for a person, or a kind word that they want to share with that person to encourage them. Guys, I'm sure it's been more than 4 years of them serving and doing what they do here in the Trinity Garden area, here at the Community Center. This person doesn't just deal with the Trinity Garden, but also in the Tunnel area. I mean, they give their part, they give their all. You call them late at night. They may not answer, but they will call you back. Guys, I want to introduce you to some who don't know, or they know the name, but they don't really put a face with that name. And that person is Mr. Herman Thomas. This next person has a door. You know, you look at the door and you say, okay, when one door closes, another door will open. But this person has a door, if it opens just a little bit, they don't close it all the way. They have just a little crack because they don't ever know who's coming, who has a question, or what they may need to go and do. But this is something that they've been doing all their life, giving back to the community. Always reaching out to help, as they say, you reach back and you bring one with you, educating, sharing information. I mean, they go above and beyond. If you just have a question, you sit down and talk to that person, they will do the same. They will talk with you, they share information, they encourage you, and they ask you to give your all and be your all. Guys, and I'm sure you know who this person is, Miss Leevones Fisher.
Why we wanted to have this town hall is because, of course, things that we've been seeing in our community. We got started probably about 2 years ago. Before that, we've been having town halls. Before that, we put plans and things and strategies in place. It's Mr. Dotch. Y'all probably received this already. But one of the things that Mike, some years ago, we was talking and he went out in the community. And this was one of the things that he wanted to talk to people in the community. And I appreciate Mike, because one of the things that I know a lot of times we see things in the community and we want things to get better. Because anytime we lose a life, that's a problem. We don't want to lose any lives. But at this time, same time last year, we was at 30% higher in homicides. But we've been out in the community, going into schools, talking to people, and Mike as well. And that's been the thing that we've been wanting to do. We want to continue this conversation, but at the same time, we want to create solutions. And so I'm passing Mike's passion, and that's the goal tonight. We want to come up with solutions. We want to figure out what ways that we can add to what we already present. You're going to hear about things that we already have in the community, but at the same time, we want to figure out how can we move our community and city forward together. A lot of times we point fingers at each other, but we have to come together. We're stronger together, and we have to figure out how can we move our community forward and our city together. So tonight, what I'm asking you to do, I know we're angry sometimes and we're mad about different issues, but we cannot solve our problems with hate. We have to solve our problems with love. So when you come, let's figure out, when you come, think about how can we solve the problem. Think about if you already have a solution. When you hear someone talk about the issue, think about like what ways can we solve that problem. And I will be taking notes on my phone because I'm always thinking about different strategies of ways that we can solve problems. So tonight, what I'm asking you all, think about ways that we can work together to solve these problems.
So I, as mentioned, am a trauma surgeon here at USA Health, but also I serve as the director for the USA Health Center for Health Communities. And so half of my professional time is dedicated to community engagement, community outreach, and research. And so a lot of the programs that I'll talk about fall under that umbrella of the Center for Health Communities. So the first one I'll talk about is a partnership with the City of Mobile and the Mobile County Health Department. But maybe about 7 or so months ago, we were awarded funds from the city and the Mobile County Health Department to stand up our first hospital-based violence intervention program. Many of you may know Joshua Jones, but he is the lead on that program and helping us to stand that program up. But essentially what that program is when patients come in and they've been directly impacted by gun violence, meaning they are a victim of gun violence, they're coming in with a gunshot wound. We have the resources to immediately respond to the bedside to be able to, one, establish a trusting relationship with the patient, but also with their families. And the whole goal is to merge the social aspect of care with the medical aspect of care. So we've been doing the medical aspect, but there was so much room for improvement in terms of the psychosocial and the emotional side, what happens when you're affected by gun violence. And so I'm really excited that this program is in the works. Our violence intervention professionals, or many of you may have heard them referred to as credible messengers, they're going through a series of trainings right now. One is the community health worker training, and the other is a specialized training on violence interruption with the HAVI. And the HAVI is a national organization called the Health Alliance for Violence Interventions. And they have helped to stand up 10, probably just south of 100 programs across the country. So we're not starting from scratch. We're learning from programs that already exist and that are evidence-based so that you don't have to reinvent the wheel. So they're going through the trainings, and we expect to have a soft launch of that program in July with a hard launch in August. So things are moving right along, and we're just so excited to be a part of this process. Many of you may know that we have a partners meeting for the HVIP, or the Hospital-Based Violence Intervention Program, on June 10th. At the Goodwill Center. If you don't have that information, you want to be a part, you personally or your organization, please reach out to us at the Center for Healthy Communities or me. I'll be here until the end of the program, but we'd love to get you to be a part of that meeting so that we can all brainstorm together. Because this care doesn't just take place in the hospital, but longitudinally when the patient is gone from the hospital and they're still in that recovery phase. So we will follow these patients longitudinally. The second program I'll mention is called Project Inspire. It's probably one of our longer running programs. We started in 2018. It's a partnership with Strickland Youth Center. And so they refer kids to us who have some sort of gun offense. And they come into our program. While the trauma center is home base, our classroom is really the community. And so we go out, and the whole idea is to provide education, exposure, and mentorship. And I think the mentorship is really what's at the heart of the program. We've seen a lot of good success. When you look at the rates of recidivism or the rates of reoffense across the country, you're looking at somewhere between 40 and 60% chance that you're in the system, you will go back to the system. And so our goal is to prevent going back into the system, but also from becoming a patient at the hospital. So we're looking at reducing injury and reincarceration. And so again, we've been running since 2018. Our rates of recidivism are 20% for all causes, not just gun related. And when you look at gun related, we're at 10%. So good progress compared to the national average, but certainly always looking on how to improve, how to not lose those kids that have gone back into the system. And so if you have any ideas there, I'd love to talk more about that program with you. And I'm like Councilman Penn, I'm looking for new ideas too, and certainly don't have all the answers. But I did want to share that program with you. One other thing to highlight about this program is that it's starting to scale. And what I mean by that is there are trauma centers around the country who've heard about it and looked at the data, looked at how impactful it is, and have brought the program to their center. And so we have Level 3 Trauma Center in Meridian, Mississippi, the University of Nebraska, of all places, and then San Antonio is our newest one that we just got finished training there. So starting to see some growth in the program, not just here locally, but outside. And then the third program I wanted to mention is called the Building Safer Communities Collaborative. And the idea of this program is to provide that same infrastructure that we provide for patients in the hospital that I mentioned, that peer support, that longitudinal support, also providing that at Strict Community Center. And so we're in the process of building that. This is the building phase, I guess. Lots of programs going up, which is great. And so I'm excited to be a part of it, excited to see the fruits of all of our labor and the collaboration and the connections that come from all of these programs.
Feel about this evening that we have so many visitors to the hood up in here. Praise God for you. And I'm sure that we need help. When you drive through this neighborhood, you will see a lot of houses out here that need help. And I only understand that the city of Mobile put maybe $100,000 for home repair. And hey, we have 1,500 homes out here in this neighborhood, and even mine needs some repair somewhere. I can find a hole somewhere. There are a lot of problems with ditches. Look like I'm never going to see all the ditches in Trinity Gardens closed. Because the ditches have water. The water will have what? Mosquitoes, snakes, rats. We have trees. You drive down 22 streets out here. We have trees growing in some of the ditches. I call that neglect from the city of Mobile. I don't know what department that is. I'm just pulling, I'm speaking, y'all. I'm just telling you how I feel. We need help. And the city can help us. If not the city, the county. If not the county, the state. We need to go to KI, whomever, to get some help in this neighborhood. We are considered to be a low-income neighborhood. That's what the city paperwork says. Now, I never thought I was low income until I left and went to college. All I had was one suitcase, and everybody in college had 10 suitcases. That's when I discovered I was low income. When I went to undergraduate school at Talladega College, I didn't know I was low income. But this city recognized this neighborhood as low income. We need police protection. We need fire. We shouldn't have a house burning down. We have a house burning down in this neighborhood every year. That makes no sense. There are a lot of problems that we are confronting daily. We have somebody on every street with lupus. That makes no sense. We need an answer to these diseases. We have men with prostate cancer. We have women with breast cancer. We do need help in this neighborhood. We need help. We have people living in old houses that their great-grandparents owned without light, gas, or water. And then you worry about guns. The children are upset because mama is upset because mama is living in a house that does not have the basic essentials. So we need help. Maybe I'm the only person in the room that realizes we need help. Sometimes you got to have a drum major. Every band has to have a drum major. Somebody who is going to say, here we come. We might not have uniforms. We had baseball teams out here without uniform. We just put a t-shirt on, we got a marker, and wrote on there, Dotch Smith. We need help. So, I'm going to wait on my neighbors and my friends sitting in the audience to speak up. Now is the time. I already gave you my opinion. Now give me yours.
How's everybody doing tonight? I'm going to let Deputy Director Graves talk about all the prevention mitigation programs that we have, but I'm just going to address kind of some other things that we've been dealing with in the city. The first thing is we really do have a good team at this point. And one of the things that we addressed, or we're addressing, is mental health. Curtis established a crisis intervention team about a couple of years ago, but it was real small. We couldn't really get a lot of buy-in. Then I came in, I brought Curtis in, and I'm happy to say that Chief Jackson, our current Chief of Police, has dedicated a promise by the end of the summer that we will have one person in every precinct, in every shift, trained crisis intervention. So that means if there's a person with stress, that we can dispatch the proper individuals to handle that person. This started getting utilized well because a couple of weeks ago we had a person who was in distress and shooting at cars on Dolphin Street, and they will be able to respond. We responded in a way where you didn't have to shoot the individual. You talked to him, you treated him how we should do. You dropped the weapon, and took the custody. We're getting him down to need. I'm glad to see that EMA is here. Something else that Public Safety just put together. We put together a brand new plan for disasters based on the National Incident Management System. We got done today about 3 o'clock. We had our second tabletop exercise regarding hurricanes on response. The first one was internal. The second was external. Not only did we have people from Mobile, we had people from the community. We had EMA there. We had the county there. We had people. We had people from USA Hospital. How we're going to handle major disasters in the shape of a hurricane. Also, something that's been in everybody's mind to talk about is cameras. So, as you know, a couple of weeks ago, we had a shooting in St. Park that the cameras didn't work. Well, prior to that, that every department had their own cameras. Department of Rights had their own cameras. Fire department had their own cameras. Police department had their own cameras. Thanks to Cory Penn, we are unifying that camera system. They gave us money to start repairing replacing the broken cameras. One thing we found out, we have a lot more cameras than people told us that we had. And we have a lot more broken cameras than people told us. So we're working through that problem. And it's going to be on the next year. Me too. Last thing I just want to touch is our chief and his staff are doing walk talks every other week throughout the year. And it's important, just like tonight's report, that we get in front of you, because I see reports, I see statistics, and I try to make decisions based on those statistics. But unless I get out and see you guys face to face, you guys tell me what's your problem, I can't address your problem. And I'll tell you this, as especially for me tonight and before, Tim probably did tell my problem, but I can report it, and if I find it to be great enough, I will go get the person whose problem is and drive to that area. Recently, we had a complaint that there was a walking about dogs creating a problem in the neighborhood. It's not my issue. I'll always take this under control. But I thought it was such a bad deal for the neighborhood. What's going on? I went and picked up the record under control, drove out to the site. Within 2 business days, those dogs were gone. Because that's all about public safety. People say, things like this don't change anything. Things like this don't do anything. If I don't know about the problem, I can't help. If police department can't help you, first can't help you, important can't help you. So we really need to understand what's going on in your community, because much more than what I see on police blotter or reporting. We need to hear what's going on. So I appreciate everybody who's coming out tonight.
Thanks, Kendell Young, the homeless outreach coordinator for the city. My role in the city is to connect our homeless population with services in the community. We have some outstanding partners that assist us in this effort. When we think of homelessness, it's really not a city issue. It's a community issue. It's going to take the community to help us alleviate, manage, and mitigate this problem of homelessness. Every community in Mobile, matter of fact, in this state, in this nation, is dealing with homelessness, and it's only going to get worse. There's over 500,000 people that sleep outside or in a place not meant for habitation every night in the U.S. So what the city has done with the creation of this position, it allows us to provide that engagement and encouragement for those individuals that are experiencing homelessness. So we have a team that consists of 2 police officers currently, and we go out and we encounter the homeless, trying to connect them with the various services that they need. Each individual is different. It's not a cookie-cut solution when it comes to the issue of homelessness. So we have to encounter these individuals, engage them, have a conversation with them, and know what their needs are. And once we know what their needs are, we can connect them with the organizations that have already been operating in our community. You'll be surprised around how many people that don't understand the services that are out there and that are available to them. So when we go out and encounter these individuals, we're able to provide them the things that they need for their specific situation. We do it in a caring and compassionate way. There's no criminalizing the homeless. There's no trying to force the homeless to do something, but we engage them compassionately. We provide them everything that they need that will set them up for success. We recently partnered with an organization, a 501c organization called Rain Group, where they're putting a resource center in our city, a place that will be available to provide services to not just homeless individuals, but any individual that want to better themselves, economically better themselves, with job training. It's a center that will be designed to make individuals better. It's all about creating sustainability, and it's going to take a community to do this. No one organization has the resources to eliminate homelessness. So it's going to take all of us working together to be able to manage and mitigate this issue that we face in our city.
Good evening, everyone. I want to start off by saying this. I'm sure you probably want to know more about why I do what I do versus why I'm up there for the city. Because for me, this is about my community. I'm not from Trinity Gardens. I'm from Oakdale. I'm from Oakdale. I've been in law enforcement for over 32 years. I will tell you that I've worked in almost every area of law enforcement. I've worked narcotics. I've worked gangs. I've worked child abuse investigations. I've worked homicide. Also worked in the school system. I've had a full range of experience and understanding of what issues are, and I still don't have all the answers. I don't. I never will. What I do know is this. I don't like to quote politicians necessarily, but Ronald Reagan said this. He said, someone else said it before him, it goes, so goes the family, so goes the nation. Okay? When families start to erode, so does the community. And when the community starts to erode, so does the city. And as the city erodes, so does the state. And it continues. It is a situation that has a ripple effect. We will never sit here and solve all the problems of the home without the home being part of the solution of addressing the home issue. But what we can do is address what we can address. For me, it's been my life to figure out how do I bring prevention intervention strategies into the framework of law enforcement. How do I bring in different things that we're currently doing now into the environment, into the sphere of law enforcement? Because prevention intervention should be the key and nucleus of what we're trying to accomplish. We don't want crimes to happen. We want crimes to not happen. So we have to, at the core, identify how do we integrate strategies into agencies where we get agencies participating in the reduction of crime outside of the arrest of people that are bad actors. The community will always play a part in that, but law enforcement has to also develop strategies within its own systems to help in mitigation, not just the response of addressing bad actors. We have a couple of different people here today that I want to make sure I acknowledge that are part of that. We have our family intervention team that's been in place for, I think, since 1990, I want to know, maybe 2000. Chief Garrett, former chief of police here, actually created that program, and we still have that program today. That program is in our schools. They work closely with our school counselors. They work closely with our families. The whole goal is to keep kids in school, okay, so that they're not on the street, to find out what families need to help them in their mitigation in the home, to address things where their child is not going from school to prison or dead. So, and that takes the community, and they are doing that. We have also our victim services program. Our victim services program is a systems-based program designed to engage people who are victims of crime, to, first of all, to make sure that they get the services that they need, but also to make sure that victims of crime don't become perpetrators of crime, and making sure that they are at the core of their engagement with law enforcement, because law enforcement is tasked with addressing crime. And oftentimes when a victim of a crime is a victim of a crime, they're still a victim, even after that case has been, where someone's been arrested or whatever. The issue is that they're still dealing with their victimization, and they need to have someone in place that can actually be with them, do a more handoff to other agencies, other nonprofits, but more than anything, be a friend to them when they need one, to direct them on things that they need to do as they get out of that sense of being a victim of crime. So those are things that we're doing. That's the program that we started several years ago under being director, our chief, Lawrence Baptiste. That program has helped a number of victims of crime. We have them here also today. They're here. We're the only agency in the state of Alabama, municipality, that created an internal system where we have victim services inside of law enforcement. There's one other agency, I think it's in Shelby County, it's the sheriff's office, but we're the only municipality in the state of Alabama that has a program in place for victims of crime, so that when they see a law enforcement officer, they also see a victim advocate. Okay, so those are things that I thought were necessary and others thought were necessary to make sure that we're trying our very best to integrate prevention and intervention strategies into the framework of law enforcement. I can name a number of other programs. Our homeless outreach, Kendell's doing that along with Justin. I will be standing over there working with our homeless outreach. We have our mental health program. We are currently leading the state in our efforts as it relates to mental health, trying to figure out how to train our officers on how to de-escalate people who are having their worst moment. Because we understand that when their emotions are high, their rationality is low. And the last thing we need is for an officer to go up with the same level of emotion, because no good outcome comes from it. So, but we have integrated that into the framework of law enforcement here in the city of Mobile as well, because we want to make sure that we're reducing the negative footprint of law enforcement in situations that we can prevent or that we can actually mitigate. So that's a program that we're very proud of. We're working closely with our mental health partners. We have iPads now, so that, because we can't have a clinician on every call in person, but what we can do is have someone on an iPad that can be seen by that person who's in crisis, so that they can talk to that person while they're in crisis and hopefully get them to de-escalate and to hopefully come to the crisis center. So, Ms. Barbara Drummond, I think she's involved in that part of it as well. So we have a lot of people here that have been working diligently and trying to help us figure out how do we actually increase prevention and intervention strategies into the everyday things that happen in our city. But I will tell you, I'll go back to the family again. So goes the family, so goes the nation, so goes Mobile. And what we have to do is figure out how do we get families to engage in what we're trying to do within our agencies. because we're only half the solution at best. We're only half the solution. But we have to figure out how do we get families more engaged. And the community, Trinity Gardens is unique. You guys have a network. You all have a family-oriented community here that you pull together. I've never seen it. I don't see it anywhere else. And if it is, maybe I'm missing it, but I don't see it anywhere. So you all have something special here. So maybe there can be something that can be duplicated here, elsewhere. But it all starts with conversation. And I don't want to continue. I want to hear from you all as well. So I'm going to stop here and hopefully we'll start taking questions from there.
I met with your director about creating a logic model for the city about trauma-informed community. I just want to know what happened to that, because I always came as a Marine, we said we come with solutions, not just address the problem. We came with a solution saying, hey, because we did the data, we did the homework, we did everything, the influence of mental health in this community. Education is a big piece because we have dumbed it down for our children. Our children don't have homework like they used to. They're on the street because we dumbed down education. We're not training them and teaching them and equipping them. I brought everything to you because I'm going to tell you how this happened to me. I was in Oklahoma City, and I remember a bishop saying to us, he prayed for the heart of his city. And so I stood there on that memorial praying for the heart of my city, Mobile. And then I started praying for the people of Mobile, that God would give me a heart for this city. And so he gave me that logic model, but I heard nothing about it because you say come with solutions. Not just addressing the problem, but solutions. Just like in the homeless population, we came to Gina Gregory to talk about what we did at Ransom, and we got them off the street by the World of Work program, and the city was able to commute that or even fund that program so that now we were working with Waterfront and getting them out. Because you say come with solutions, because we can all address the problem. But when you come with solutions, you silence us at the same time when we brought a solution. So I'm really concerned about what happened to my logic model. What happened to the conversation that we had with that? I gave you multiple copies of it because I know things don't happen in a vacuum. It takes collaboration. It takes community. It takes all of us working together. If one child is hurting, we all hurt together. If that's community, because community represents unity. So I just want to know what happened to all the things that you say come with solutions and not just address problems. And then the second thing is, I want y'all to meet Tiffany, because what she has done with young women who have been in a situation that is really, really working to make things better for the women in our community as well. I just want to know what happened.
So, education and school system, we passed on. I have a lot of things under control, but I can't affect school curriculum, and I can't affect how we respond to schools. We do have a trauma-based approach, and we put significant money into the hospital-based violence intervention program that Dr. Young spoke about. And we have had discussions, and we've had, I take your information and send it to the people in the school system and in the education system.
It had more than just a school system in there. It had much more, because I asked the question about trauma. It's about creating a trauma-informed community. It is not just the education piece. It's also about law enforcement. It's also about teaching them mental health so they can be able to address these issues that we put out there. It had much more in it. It had the data.
So let's talk about mental health. We put additional people in the school. We have the super medical program that Dr. Penn Graves talked about. We have the trauma informed and addressing the trauma through our HMIP program. And we're doing a lot of things that are in that program. But some of the stuff that you want to see done is beyond my control. Again, we're addressing mental health in schools. We're addressing our kids younger and younger through different programs, through Bridging the Gap, through some other school-based initiatives, like I said, we have the family intervention team, we have the school liaison. We're doing a lot of pieces in there, but just because we didn't embrace your program, hire you, and bring everything on, doesn't mean we follow that ears. Listen, and we're taking advantage of what we can.
I want to address the mental health, and that's one of the things that we have in our community. We have some people that are living in the home that their parents are deceased, and they're living with other family members. Then we have some that may be on drugs, and they cannot stay in that home, and they become homeless. We had a homeless person that Trinity Garden is a part of two cities, Pritchard as well as Mobile. And we had a homeless person they found in a home, abandoned home, and I guess he probably passed when the storm came, the snow came, and they found him. And we don't want that to happen in our community. So what do you all have available for mental health? Because they're self-medicating themselves on drugs, and they actually need help with what is going on with them. And family members don't always understand that this is what's going on with them. So what do you have in place for our people in our community who are homeless and doesn't have anywhere to go?
So if anyone have a homeless situation that needs to be addressed in our community, you can do it in about two ways. You can reach out 311. You reach out to 311, that report is filed in in contract with the city, but it'll get to our office, and we address those issues as they come in. So when it comes to a mental health situation, things are very, very complex. It's as I said before, it's not a cookie cutter situation. When you factor in the mental health piece too, we have a mental health response team that can go out and deal with issues with our partner and ultimately. So situations are different. They can be very complicated or they can be very easy. When it comes to mental health, you can't force a person to receive mental health assistance. It has to be volunteer. So that's kind of the issue that impacts a lot of the situations that we face when we deal with individuals that are helpless. All I can tell you is when you have those issues, please reach out to us because it's a community problem. And when the community tells us about the problem, we are then notified and then we have the ability to address the problem as much as we can. We can engage those individuals, have conversations with them, develop that trust that needs to be developed in order for them to know that we have their best interests at heart. Once we get that trust from them, then there's a greater probability that they will want to do something about their situation. We're not going to force them, but we're going to encourage them to be connected to the services and the things that will help them in the situation that they are in.
So let me add. So we have to look at mental health in a whole different way than we've ever looked at before. And although, as Kendell said, you can't force it. What we are going to do, what we're proposing next year, we're trying to get the sponsor for the state legislature, is our neighboring state, Florida, has something called the Baker Act. Okay, the Baker Act allows for those people to be involuntarily committed for up to 72 hours. Okay, just so they can be evaluated and treated by a physician. A lot of times, you see the mental health manifests itself because they're off their medication. And if we can get them in, stabilize them, get their medication. But beyond the actual Baker Act or the law that allows us to do this, we need the state to start funding beds. All the Point has, I think, 6 beds. Where I grew up, there was a whole floor of a hospital called National Memorial that you could take these places people to. They would be treated with kindness, respect. They would get back on their meds, and they would flatten out so they would go back into society. But that's something that we're going to have to address with the state legislature and the state to get funded. Because right now, no city in Alabama has the necessary bed space. And when they got rid of the state drug institutions, both in Florida and Alabama, things of this nature became a bigger problem.
I'll just add one thing. Everyone that we see, I know you guys know this, some of you should. Everyone that's exhibiting mental health-like symptoms are not mentally ill. Sometimes it's substance-induced. And because of that, they may not have a diagnosis. If they don't have a diagnosis, then they can't be treated for mental illness before they can be treated for the substance abuse issue that they have. So the substance addiction has to be treated first in order for any type of mental health treatment to even follow behind that. So what we see in the community more often than not are those who are mitigating mental health symptoms, but they are often substance-induced, and they've been on for years. So if you see them for years in the community, so you think they're mentally ill, it's substance-induced illnesses that they're dealing with. So those are 2 different animals that you have to deal with. Now, you can have both. You can have a mental health diagnosis, and you can also have a substance use issue. Oftentimes, people will find themselves treating their mental illness with drugs. So that's another issue. So there's so many different layers of the problem. But the only way to identify is to have them actually from needs. And oftentimes, the way you see them is by arrest, unfortunately. Then they commit some type of offense. And then you can figure out whether this person has a substance issue along with mental health issue. And if they don't agree to seek mental health treatment, a substance use treatment, so they can also get their mental health treatment. That's it.
Another thing I want to address, we have, even our community who is coming back, they've been arrested, they have served their time, and they're back in the community. And what do you all have to provide them with some type of training or maybe a job, that they can, have a job and not just be in the community and asking for help, but something that can help them to help themselves once they have been, released from prison and come back to their community.
One of the things they have now, when they come out of jail, chances are they're going to the day reporting center. If they're going to the day reporting center, then there's a process they have to go through. One of the things they actually did at the day reporting center after coming out of prison is they meet with one of our fatherhood facilitators with the health department. These are partners of ours that work with us alongside our second chance for health programs, the police department. But they meet with these fatherhood facilitators at the day reporting center, often in the tropics. And they work with them on trying to help them reestablish themselves, try to get their driver's license. They take them through a mentorship program that's an evidence-based program called 24/7 Dad. That's through the health department. And they also work with them on a number of other issues that they're trying to identify, trying to remove barriers. Housing is going to always be an issue. It's been an issue for a long time. There's very little currently that we can do to address that. Unfortunately, a lot of them go back into the communities that they came from, dealing with the same issues that led them into prison. So recidivism rate tends to be what we don't want it to be. However, there are services available for them when they do come out, and they have to actually go through that. They actually get directed to employment as well. So there are a number of things, and I know that a lot of people don't know these things because it's not advertised to the general public, and sometimes it can be out there, but if you're not looking for it, you'll never hear it because you're not attuned to it. It's not until you need it that it may have been spoken of, but you weren't listening for it because it was not something that was on your radar at that point. But those services are available.
I don't even know how to begin, but I'm just gonna pour out my heart. I think we all being allowed to have the same narrative continue to be pushed on us, on our community, which is gun violence and drug dealing. Like, that is all we have going on in our community. First of all, we got to change the narrative. Stop pushing that age-old narrative of gun violence and drugs. When I was a kid, they was pushing the same narrative. The same narrative is depleting our neighborhoods. If you go to each black neighborhood in the town of Mobile and Pritchard, stand up for a second and see what you see. You don't see nothing. You don't see nobody. All of our people are being incarcerated. All of our people. Generations are gone. We can't rise up. You know why? Because all we have in our community is police, sheriff department, Mobile Police Department. All we got is police in our neighborhood. Where are the funds? Where are the funds? No funds are being allocated to build up our neighborhoods. These children don't have nothing to do. If 3 or 4 of our children ride around right now, they're pulled over and stopped. We got to change the narrative. That's right. You so right. You definitely right.
We won't get out of that. It needs to be rude. It needs to be what?
That's right. That's right.
We got stuff.
And not just for guns, this right here. For other things. We should have other things in our community. All that we have in our community is gun violence crimes. That's it.
This is Tam. Excuse me, we're gonna let Councilman Penn respond to that.
Yeah. How you doing? You say your name Terrence? Hey, how you doing, Terrence? I appreciate you sharing your heart. I think it's very vital, and I appreciate you coming tonight. I'm Councilman Cory Penn. Kind of just want to share a little bit. This is my first term, so I've been in 3 years. I'm 40 years old. I started at Chastain Middle School as a teacher. Started 5 years. I was a teacher at Chastain. I lost probably 15 kids. I know you're sitting there. I'm just telling you my story. I lost 15 kids to gun violence at Chastain. I understand. I'm just telling you my story. From that point, I realized I wanted to create change. I wanted to see a narrative. I was only 21 when I started teaching. I went to the Boys and Girls Club, and I was a character and leadership instructor right there in Optimus, in RV, where at the time, Orange Grove shut down. I don't know if you remember that. They moved them to RV. A beef started with RV and Orange Grove, and there was a lot of violence took place over there where I had to walk kids to their house. You're right. Sometimes as a community, we push that narrative. Sometimes, but at that moment, violence was taking place. I agree with you at this moment. I think sometimes we do have a narrative that we push in our communities. And that has created where, like, violence don't take place in other communities, because violence takes place everywhere. Violence takes place everywhere. But at a certain point, we also as a community got to rise together, like Ms. Sweet says, and we got to come together. Now, I also want to kind of disagree with you on some things. I think we got the best community. Let's talk about Trinity Garden. You can't find too many communities in Trinity Garden that has a pool, a community center, a playground, an amphitheater, a baseball field, a football field. You tell me what community in West Mobile have that. Let's talk about Tomerville. Tomerville, we have 2 parks in Tomerville. We have a pool in Tomerville, we have a baseball field, we have a basketball. I'm telling you, let's go to Aaron Park. You can't find no community in West Mobile that have the resources that Tomerville. What I think we need to do is tell our own story and have our families come back. So Terrence, what I tell you, I need you. And I need us to come together. What we have to start doing is we have to stop fighting against each other, and we got to come together and we have to build our community. Now Terrence, let me tell you this. From a business side, the city of Mobile, we can't keep looking as the city to take care of our community. We have to take care of our community.
We have to take care of our community. Now, can the city provide some funding? Yes. So let's look at Highway 45 that we put $3 million. We can do infrastructure. Let's talk about the ditches. Yeah, we can close ditches. But from a city, as a community, we have to open our own business. We can't look at somebody else and say, y'all come to our community and open business. We gotta open the burger shop. We gotta open the ice cream shop. We have to build the houses. So we gotta come back to the community. But we also gotta tell the truth that we got one of the best communities. Trinity Garden got it going on. Tumblerville got it going on. Mayville got it going on. But we gotta love each other. And when we love each other, then we go to the next level. So Terrence, I need you. I need you, because I love it. You're right. It's some points where we are telling that narrative. And that's not the truth everywhere. It's violence everywhere. But we need change. And the only way we're going to see change there is if we stop fighting against each other. When I say fight, point fingers. I know what you did, you told your heart. But me and you never had a conversation. If we sit down at the table, Terrence, I can tell you everything you want to know about the city business. Stuff I didn't know 3 years ago. And I can break it down to you. And then now guess what you're going to go do, Terrence? You're going to tell your friends. And then now, what Ms. Sweet said, we can organize. And then we create change together. Can you do that, Terrence? Let's have lunch together. Can we do that? Let's do it. And I can share it with you, and we're going to move forward together.
Let me get one more question.
All right.
Wait. Okay. Question.
I just want to make a statement. I agree with the brother over here. My name is Darryl Evans. I grew up in the Tumblerville community. When I came up, we had a neighborhood. When I moved to Tumblerville, Barber Drive, and Somerville Street, it was 10% black, maybe 90% Caucasian. So I came in the neighborhood. When blacks started moving, our neighborhood, we were neighbors. Now I hear people, I heard the state senator state this in one of these meetings. I didn't cry. She said, I live in the hood. What happened to the neighborhood? I'm looking around, I've been going to the gun violence thing here. I'm here tonight. I see all the senior citizens, all our senior brothers here, and they're concerned. But where are your grandkids? Why they not here with you? Where the nephews at? So they can carry on, but we're not gonna be around here too long. I tell people life is like a baseball game. Right now, 80% of us on third base heading home. Game almost over. So you need to bring the young people in and let them see what we're doing here. He said change the narrative. You got to understand the problem before you fix it. The problem is we've allowed our neighborhoods to go down. Are we educating our kids on how to pay property taxes? A lot of black families are losing their homes in Tumblerville, Pritchard, and Trinity Garden to West Mobilians. They're moving back in. They relocate us out of the county. So we lose our vote strength. This is what you really need to be addressing. That's a big problem we have. Right now, I can guarantee you, 30 to 40% of Tumblerville is not owned by us. They're coming back, they're buying foreclosure because Bobby didn't know about paying property taxes. He wasn't educated. Obama said, boy, take care of business, you go in your room and play. By the way, to watch TV. TV, television. Everybody here tonight, you're no threat to us. You're no threat. The people that need to be is out in the streets. That's where we need to go, out in the street and educate our kids. They don't know what's going on. That's the reason they call it, they tell a vision. They telling our kids a vision. That's what they learn, that's what they do. Biggest problem we have right now is Hollywood, California. They set the narrative that caused all these problems that y'all talking about. It took address Hollywood, California, the music industry, and the cartoon. The cartoon industry, you're not gonna solve something, the problem will get bigger and bigger. I've been listening to this for the last 50 years since King was killed, and we still talk about the same problem. We're just chasing our tail like a dog. Chasing our tail like a dog. Just put it in real. And progress has been made, don't get me wrong. But until you address the issues that I just talked about, we're gonna still be chasing our tail.